Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, June 2nd. We're joined today by Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpretation is provided by Mary Thiessen. Unfortunately, we will have no French translation this week. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have 2 questions. Premier Silver.
Thank you very much, Pat. And thank you, everybody, and good morning. Thanks for joining us on the traditional territory of the Kwanlin First Nation and the Ta'an-Quachin Council. It's very great to be here with Mary and with Dr. Hanley. Before I get into the COVID update, I just want to start by acknowledging the discovery of the 215 children on the grounds of the former Kamloops Indian residential school last week. This is devastating news, and I, like everybody else in Yukon, is still processing this information. My heart definitely goes out to those in British Columbia and also here in Yukon and across Canada who bear the burden of residential school experience. There have been lots of powerful actions and discussions over the last few days that have been very, very important. It has been moving to see Yukoners pull together and support each other through this very difficult time. The pain caused by residential schools is an ever-present part of our society. We need to acknowledge this shameful aspect of our nation and strengthen our resolve to advance reconciliation, now more than ever. All Canadians need to work together to address our complicated history and create a brighter future for the next generation. My government stands with Hashadahan Dixon and supports the national call for a full investigation into residential school sites. We remain committed to working with our First Nation partners to advance reconciliation, and we will be having conversations at the Yukon Forum this Friday. Turning to the update to COVID and the situation in Yukon, things are going well here. Over 78% of Yukoners have now received their first dose of the vaccine, and more than 70% have received their second shot. The Yukon is leading the country when it comes to vaccinations, and that is why we lifted restrictions last week. As of May the 25th, people who are fully vaccinated can travel to the Yukon without needing self-isolation. Now, fully vaccinated means that you've received the recommended number of doses of COVID-19 vaccine authorized for the use by Health Canada, and more than 14 days has passed since you received the last of the recommended number of doses. When you enter into Yukon, you must sign a declaration confirming your vaccination status, consent to verification of vaccination, and provide proof of completed immunization schedule when required. If you were vaccinated in Yukon or in British Columbia, you're required to sign a declaration and consent form. You're not required to provide any additional documentation after that, as your vaccine status can be verified through the Panorama database by Health and Social Services staff. If you were vaccinated somewhere else other than Yukon or British Columbia, you must provide documentation from that jurisdiction where you were vaccinated. The documentation must clearly identify the jurisdiction in which you were vaccinated, the vaccination dates, evidence that you've received all required doses of a Health Canada approved vaccine. You can scan or photocopy your proof of vaccination and submit it on our secure online portal. The secure portal is only seen by Health and Social Services staff authorized under HIPAA, which is the Health Information and Privacy Management Act. They will be there to verify your documentation, and this is the process until a formal consent national record is developed. Last week I met with our fellow premiers and the Prime Minister, and I reiterated my call for a national registry to verify vaccinations. We all recognize the importance of protecting private health information, but also ensuring that Canadians can travel throughout the country as it becomes safe to do so. We are ahead of the curve here in Yukon, and we need to keep that up. I keep in mind what Dr. Theresa Tam said when she called the Yukon a model that we're all looking towards for success. The eyes of the nation, they're definitely on us as we get ready on the path of recovery. This week, our youth vaccination rollout began in Faro, Watson Lake, Whitehorse, and Haines Junction. Youth can book appointments in Carcross and Tagish later this week, and also in Mayo, in Pelly Crossing, in Carmax, Dawson City, in Teslin, Old Crow, and Ross River in the coming days. I want to thank all of the youth who have already stepped up to take their shot. And I also want to strongly encourage all of our youth to get immunized. As Dr. Hanley can attest, immunizing our youth will lead to a dramatic reduction in the risk of spreading COVID-19 in our territory. You have heard me say before that the more people that get vaccinated, the safer that our territory will be. This is still true. So please, set up and take your shot if you haven't already. You can also book your appointments online at yukon.ca/this is our shot. As our vaccination rates continue to increase here and across Canada, and as the case count slowly but surely declines in the provinces, we will soon be in a position to lift more restrictions. Dr. Hanley has provided our government with new recommendations, and the public service is doing the appropriate work and due diligence to operationalize these recommendations. If things continue to go well, Yukoners can expect changes in the coming weeks, around mid-June. One in particular that I know will be welcome news to many families in the territory has to do with children under 12 years old. The plan is that unvaccinated children under the age of 12 who are traveling with fully vaccinated parents and caregivers or caregivers will not need to self-isolate when they enter the territory. I know that many Yukoners are anxious to travel and to visit family they have not seen for months and maybe introduce some new members of the family. It is still very important to respect the travel requirements that are active in various Canadian jurisdictions outside of the Yukon, but we are on track to make this change, as I said, very, very soon. I also know Dr. Hanley and his team are working closely and looking closely at the guidelines that apply to bars and to restaurants. Last week, public health officials met with several folks that operate bars and restaurants in the territory to discuss the updated guidelines that came into place on May the 25th. I know that this was a very fruitful discussion and that we received some very helpful feedback that will inform updates to the guidelines in the coming weeks. And I want to thank all of our local businesses, the business owners, for continuing to adapt to the COVID-19 situation that we're all dealing with, and also continuing to serve Yukoners. Thank you very much. I also want to thank all of Yukoners for continuing to support these Yukon businesses. It remains incredibly important to support our local businesses as we get on the path to recovery. Last week, Tourism and Culture Minister Ranj Pillai announced some of the details about the Great Yukon Summer Campaign. This is all about supporting local companies to kickstart our tourism season. The first package deals will start to appear online later this week. So keep an eye out and start planning. Start planning to explore our beautiful territory this summer. With a little help from the weather, it will be truly a great summer. In the meantime, again, as I say every week, please continue to follow the Safe 6+1, masking up. The vaccination uptake has been absolutely phenomenal in our territory. Thank you. But we would not be in this fortunate position without all of the efforts that Yukoners have made to keep each and every one of us safe. So keep it up, Yukoners. Thank you very much. And I'll pass things off to Dr. Hanley.
Thank you, Premier Silver. Good morning et bonjour. First, I'd like to join the Premier in expressing my sorrow at the recent discovery of the children's remains at the residential school site in Kamloops. I also want to acknowledge the anguish that many Yukoners feel so deeply as survivors themselves or as family or friends of survivors. This tragedy is a further deep scar on our country that challenges us all to understand, to answer what we yet don't know, to continue to heal through truth and reconciliation, and never to forget. As the Premier said, I have recently provided some new recommendations to the government on additional changes to public health measures, and we will be pleased to bring you details soon. We also took a look at the self-isolation requirement for children under the age of 12 and have made our new recommendations based on projections of declining risk of COVID exposure in Canada and the correspondingly low risk of acquisition by young children in the care of vaccinated caregivers. With the ongoing good news of vaccine effectiveness and increasing uptake across the country, we can increasingly see the light coming back into our world just as summer solstice draws nearer. It certainly is a different world than the one we lived in a long 15 months ago. As the pandemic approached, we prepared our response on the premise that we were a susceptible population. This was a virus that no one's immune system was primed for. Today, our experience in managing this over the past year, combined with the promise of vaccine, has changed that. We have demonstrated over and over again that we can control and contain this virus with the right measures. Now with vaccine, our susceptibility as a population has plummeted. We are much better equipped to live with this virus and keep its impact to a minimum while progressively winning back our freedoms. As we move towards new phases and new freedoms, we will also have lessons learned to bring us into a living with COVID future. We have learned how effective it can be to stay away from others when ill. We have learned that our mother's advice to wash our hands is really good advice. We have learned that wearing masks is not as awkward as we first thought and can help to protect ourselves and others from infection in the right circumstances. We have learned in healthcare how critical it is to adhere to good, consistent infection control. We know the importance of investing in and maintaining strong communicable disease control, including surveillance, testing, and contact tracing. I hope these are lessons that we can stick to for years, even generations to come. As the Premier said, we continue to see no new or active cases in Yukon, and we are pleased to see that for the majority of the country, apart from Manitoba, that cases are declining. The risk of cases coming into Yukon is therefore lower, although some risk is still present, and some risk will likely stay. The consequences of any one case or cluster, though, are not the same as they would have been even 6 months ago. Our increasing vaccination rates mean that the risk of seeing a large outbreak occur in Yukon is relatively low, and even if we were to see a large outbreak, the consequences would be much less. A population vaccinated as highly as we are means that the chance of people becoming sick enough to go to hospital or suffer serious outcomes is dramatically lower. Thus, we do find ourselves in a different place than before, and we are poised for further relaxations of our restrictions in the near future. On Monday, we began the first youth vaccination clinics. I need to give a big shout out to Hunter Wendt, who was one of the first youth to be vaccinated in Yukon. This is another remarkable moment, and I hope this young fellow is incredibly proud to be part of this historic moment. High five, Hunter. This week's youth clinics started in rural Yukon with Faro and will wrap up in Ross River in 2 rounds for 2 doses up until mid-July. While a small team goes to the communities to administer the Pfizer vaccine, the Whitehorse Convention Centre has started administering the Pfizer to the 12 to 17 age group. First doses over this week and next, and then again for second doses starting the week of June 23rd. The first couple of days in Whitehorse have gone swimmingly, with lots of kids showing up. So far, we have seen a great uptake in appointments, with the majority of our Whitehorse appointments already booked. This is another forward step in our vaccination campaign, and once again, I must commend the contributions, collaboration, and enthusiastic response of Yukoners in stepping up to take the vaccine, protecting not only themselves, but others as well. I want to again give a shout out to the organizing teams and vaccinators that have made this Operation Youth Vaccine happen so quickly and so smoothly. We will be able to report uptake amongst adolescents after the 2-week first dose campaign. What I want to strongly encourage, though, is that young people continue to come and get vaccinated wherever you are in the territory. By doing so, you will be helping all of Yukon finally move past all of the restrictions we have needed to observe in order to stay in control of this pandemic. If the youth join us in aiming for 75% plus second dose uptake, then we can be confident that we can move and gather with much more freedom this summer. Modelling by the Public Health Agency of Canada suggests that adding the 12 to 17-year-olds to our vaccinated population could save Canada from an additional wave of infection, protecting all of us, particularly older and immune-compromised individuals, as well as those unable to get vaccinated. On the subject of vaccinations, I would like to highlight some recent statements from the incredibly busy group of experts known as the National Advisory Committee on Immunizations, or NACI. One statement brings some real-world experience with the vaccines back to strengthening the recommendations about immunizing people in special categories. The experience is very encouraging. There have been no safety signals from vaccines being administered to anyone that is pregnant, breastfeeding, immunocompromised, or with an autoimmune condition. I'm very pleased with the recent update, which reinforces our encouragement for people in any of these groups to come and get vaccinated if you have not already. The NACI statement is posted on their website, and we have information on the mRNA vaccines posted on our own YG COVID-19 website. If you haven't as yet come forward for the COVID-19 vaccine, and if you still have doubts or questions, please make sure you arrange to meet with your healthcare provider. NACI has also strengthened its recommendations on the mixing and matching of vaccines. Just as I was saying last week, we are able to offer Moderna vaccine as a second dose to someone who may have received Pfizer vaccine out of territory. 2 different mRNA vaccines, either the Moderna or the Pfizer, given in either order, are equivalent in protection to receiving the same product twice. Therefore, if as an adult you did receive Pfizer vaccine as first dose out of territory, you can expect to receive the Moderna vaccine here in Yukon as your second dose. It's comforting to know the announcement of reduced self-isolation measures last week brought smiles to households across Yukon. Along with the other measures that fell into place last week, these feel like the first full steps on our way out of this pandemic. With that said, I would like to once again remind you that there are some other changes to self-isolation measures that affect those who are not fully vaccinated. As described in our Path Forward document, we need to continue to strengthen our foundation so that we can continue to safely move in the direction of opening up. Thus, if you are not fully vaccinated and are planning on traveling into or returning to Yukon, you must self-isolate for the required 14 days upon arrival. You have 2 options for self-isolation. Either, number 1, self-isolate by yourself or with your travel companions in a separate house, hotel, cabin, etc. You must choose a location where you do not have any overlap with any individuals who have not traveled. Or You can self-isolate in a shared household in a separate bedroom, ideally with a separate bathroom. And in this case, any fellow household members who are unvaccinated must self-isolate with you. However, if other household members are fully vaccinated, they can share a household with the travelers and continue to go to work or shopping or go out as long as physical distancing and other safety measures are followed within the household. And all this rather complex information is explained on the website. As always, our highest risk of COVID spread is through importation, otherwise known as travel. Our protection against COVID incursions increases with every % increase in vaccine uptake. Please keep this in mind when planning for travel. You need to have a self-isolation plan in mind if you are not fully vaccinated and re-entering the territory. And that's it for today. Please take care of each other. Remember to be grateful for what we have and stay well. And for those of you who are suffering, sad, or still reeling from the recent revelation of the children's remains unearthed in Kamloops, I don't think I could say it better than retired Senator and Justice Murray Sinclair when he said yesterday, "I pray for you all and hope that you can find a way to continue on in a good and healthy way." Thank you. Jonathan, buenos dias, masicho, et merci.
Thank you, Dr. Hanley. Thank you, Premier Silver. We'll move now to the phone line, and we'll begin with Luke from CKRW.
Hi, Dr. Hanley. I was just wondering if you could tell us if there are any differences that the youth might be experiencing as far as side effects go with the Pfizer vaccine compared to the Moderna.
Yeah, well, from our own experience, it's a little too early to say. So I don't have any. I certainly don't have any flags for anything unusual. Often, young people will feel more side effects, having more generally, having more robust immune systems means sometimes that the reactivity is higher as well. So I expect that there'll be, especially with second doses, I'm sure the young people will be having, frequent onset of feeling fatigued and muscle aches and local swelling and things like that. I know I'm preparing my own kids for that, especially for the second dose, but I think generally we'll see much milder effects for the first dose, but we'll see what stories they bring back from the clinic.
Thank you. Next question, Luke?
No follow-up for me. Thank you.
We'll move now to Philippe, CBC Yukon. Philippe, do you have a question? We'll come back to Philippe. We'll move now to Marine, Laurent Boreal.
Oh, I'm sorry. I was on mute, but I'm here. I'll ask again.
Go ahead, please, Philippe.
Thank you. The Northwest Territory is going to offer exemptions from self-isolation for travelers from Yukon. This is a new measure. Will we reciprocate and allow travel from the NWT?
Sure, if you want. Doesn't matter.
We have been working with our counterparts in NWT. We are already reciprocating because all we need, we have foregone a special exemption process as NWT is now doing for Yukon, and we're very grateful for that. And I know there are many grateful people, particularly in the Beaufort Delta, to hear this news. But we already essentially do reciprocate because all we need is that documentation, and the documentation process that the Premier just sort of walked through earlier. That documentation of full vaccination in NWT, and then you're in.
Do you have another question, Philippe?
Yes, a question for the Premier. You've spoken with other leaders about the idea of vaccine verification or vaccine passport. Can you tell us about those conversations? Has there been disagreement? What has that been like? And where do you see different leaders in Canada on this issue?
That's a good question, for sure. There's not a lot of times where all premiers are lockstep in all decisions, so there definitely is different considerations. I think really what we're seeing is Yukon is ahead of the conversation, and what we're also seeing with other jurisdictions is cautious optimism in their areas, but they are following the lead and asking us lots of questions about how we're doing the verification system, how we're working with Panorama. That type of those types of questions. We're also watching the federal government as they develop their red light, green light app, and a lot has changed from the country's perspective as far as their ability to use an app as people come across international borders. So it is all very live of a conversation. The ultimate goal is for all of us to get to a place where Canada has herd immunity, and we can see the stripping down of guidelines and restrictions in general. But as Yukon is ahead of the curve, and again, talking about our vaccination rates ever since our announcements as well, and how when you get close to the 70%, and then this news comes out and you see more people lining up to get their vaccination. I see other jurisdictions very interested in that. I've had direct conversations after the national call with individual premiers as well, just talking about the state of affairs. And I think a lot of people agree with Theresa Tam that we are ahead of the curve here, and a lot of different leaders in different jurisdictions have a lot of questions. In general, I think we have support of all premiers that we want to see. As we get from relief to recovery, we want to see a coordinated effort amongst political leaders. I think the nation has witnessed over the last 14 months the chief medical officers of health being in lockstep with their recommendations, with their following of science. I'm always urging premiers that the more we can, be lockstep in our messaging as well, I think the easier it is for Canadians to understand where we are and where we need to be, urging the other jurisdictions to take a look at what we're doing as far as lifting restrictions. I think a lot of the questions that folks have right now in other jurisdictions is making sure that we reiterate to Yukoners that are traveling out that they adhere to the travel restrictions and requirements in those other jurisdictions.
Thank you. We'll move now to Marine, Laurent Boréal.
Merci, je n'ai pas de questions aujourd'hui.
Marine. Moving on to Tim, Whitehorse Star.
Yes, good morning. I have a question for you on the loosening or further loosening of the travel restrictions, basically for families traveling. I'm just wondering what the rationale and scientific basis of that is. I'm sure people will be wondering.
Yeah, happy to talk with that. For one thing, that there is a difference in age, even in variants, because we know that with variants that we're seeing dominate the country now, that the risk of transmission in children has gone up. But still, the relative risk by age is lower, so that the younger children do have a lesser risk of transmission compared to older risk. And so really, and that's why the emphasis on the modeling that was done by the federal government is so important, showing how critical it is immunizing 12 to 17-year-olds, the adolescents, as key potential transmitters of COVID and contributing to overall COVID activity. And therefore, the adolescent vaccination will make a powerful difference in Canada, and I'm glad that we are able to contribute to that protection by our adolescents stepping up for vaccine. So one rationale is reduce transmission with younger kids, particularly very young kids. The second is that the older kids, 12 and up, do have an opportunity to be vaccinated. So again, to be able to offer this to kids who otherwise do not yet have that opportunity, knowing that adults do have that opportunity, it makes again is a kind of a pragmatic decision as well to allow safe travel to occur with young children, particularly as travel restrictions around the country will start to ease. And then the other part of this rationale is the actual modeling that we do when we actually look at, and this is of course participating with our federal counterparts and putting the component estimate. So that risk just starts to be in that kind of the 1 in 10,000, 1 in 20,000 risk that would actually happen. And then of course knowing that when we combine that with a highly vaccinated and an increasingly vaccinated population, and with the fact that really transmission is relatively still low amongst children, it kind of, all of those add up to taking on a tiny little piece of risk for a huge advantage for families.
Thank you. Tim, do you have a second question?
Yes, it's a related one. Did the government receive a lot of blowback from families protesting this? Because, you could have fully vaccinated parents having to stay home for 2 weeks to look after their unvaccinated kids. Was there a lot of pressure put on you?
No, I would say there was no pressure. What it was pointed out that there, and we knew this from the beginning, that this was something that we needed and wanted to explore further. But at the time, and I believe we even said it at the time that we brought the initial announcement about the ability for fully vaccinated people no longer to have to self-isolate, that we were looking at other groups, and we just needed to take some more time to look at the modeling and the analysis to really figure that out and bring back an evidence-based recommendation for the government.
Thank you. We'll move to Brenna, Canadian Press.
That's okay, thanks, actually.
Thank you. We'll move on to Claudiane, Radio-Canada.
Oui, en fait, Dr. Hanley, pouvez-vous me dire où le Yukon en est dans les ententes de réciprocité avec les provinces par rapport à la vérification de la vaccination? On avait une entente la semaine dernière avec la Colombie-Britannique. Où en est-on maintenant? Quelles provinces, quels territoires ont une entente avec le Yukon?
Oui, merci. The question is just about an agreement where we have agreements with other provinces for data sharing. Donc, c'est pour les autres provinces, ça reste pas avec une entente, mais c'est l'onus, c'est sur l'individuel pour avoir avec lui la documentation nécessaire. Donc c'est plus une question que on apporte la documentation, il faut le montrer dans 24 heures après, dans les 24 heures après arrivée. Et là, on a maintenant avec l'équipe de vérification un moyen pour vérifier, pour comparer avec est-ce que c'est vrai, est-ce que l'histoire est fiable, et donc c'est on peut dire, un examen individuel basé sur l'attestation, l'attestation et la documentation et la certification. Donc, ça reste pas dans une entente globale avec la province et on doit dire que ça, jusqu'à maintenant, ça marche très bien. La plupart des gens, pas loin, sont les gens des Yukonais ou des Colombie-Britanniques, mais on a vu et revu plusieurs d'autres parties du Canada. Et je pense que c'est un système qui jusqu'à maintenant, que ça roule bien.
Thank you. Avez-vous une autre question, Claudiane?
Oui, merci. Et donc, toujours en français, la nouvelle mesure là, que vous annoncez par rapport aux enfants non vaccinés de moins de 12 ans, si c'est possible juste de me redire l'annonce en français, mais aussi me dire, est-ce qu'il n'y a pas des risques là, quand même qu'on prend avec cette nouvelle mesure-là? Est-ce que ça ne vient pas avec certains risques, par exemple, pour les écoles à la rentrée?
Donc oui, je vais réexpliquer en français. C'est avec cette nouvelle addition des mesures pour éviter la quarantaine, c'est que les jeunes moins de 12 ans qui sont accompagnés par les parents vaccinés ou les caregivers vaccinés n'auront plus le besoin de rester en isolation, de quarantaine. Et donc, on a fait beaucoup de travail sur des modèles et pour une évaluation de risque pour voir est-ce que ça pose un risque d'acquisition et de transmission de COVID. Et en fait, dans ces circonstances-là, et surtout avec la diminution de l'activité au Canada et avec le taux de vaccination ici, le risque, en fait, c'est très, très peu. Et c'est un risque dans l'ordre de 1 sur 10 000 ou à moins. Et même ça, quand ça pose un risque, c'est beaucoup moins dans les circonstances où on a une vaccination, un taux de vaccination ici assez haut. Donc, on est très confortable avec cette recommandation. Et ça veut dire que même avec parce qu'on a tous les protocoles pour les soins, pour les endroits publics, même pour les écoles, on n'a pas de souci. C'est un rappel qu'on a toujours plusieurs couches. On a des dépistages, on a des sanitations pour chaque endroit. On a le conseil continuel que si on a des symptômes, on ne reste pas, on ne va pas ou, à la garderie, à l'école ou aux endroits comme ça. Donc, avec tout qu'on a en place, on est très confortable avec le risque. Et chaque mouvement est toujours, chaque chose qu'on fait dans la pandémie ou dans la santé publique, toujours ça pose un risque, toujours c'est une balance de risque. Mais la balance de risque en ces cas-là, c'est beaucoup plus sur la capacité, l'habilité pour la famille de voyager ensemble sans besoin d'avoir la quarantaine en retour.
Thank you. We'll move now to Haley, Yukon News.
Thank you. I had a question for Dr. Hanley. I've been seeing conversations in the South around youth accessing it and making their own healthcare decisions. I was just wondering if you could reiterate, do youth need their parents' permission in order to get the vaccine?
Yeah, so it's a really good question, and what we rely on is what we've always relied on for youth and immunization, and for that matter, other healthcare decisions. And that is that that consent is based on capacity and not age. So adolescents are right in that age bracket where they are starting to become autonomous individuals, and they're starting to learn how to make, as any parent of a teenager knows, they're starting to, make decisions and determine their own autonomy within the family and within society, for that matter. So consent really works the same way. So there is actually a one-pager, bilingual one-pager, on how that whole process works. So now that doesn't mean to say, of course, a parent is not wanted. I mean, really, that's a conversation between the parent and the youth, and ideally, those conversations should take place in terms of what questions about the vaccine. Some of the youth I know are doing their own research. They're asking their parents questions. They're asking others, and they're talking with their peers. So it's really making sure that the child has that conversation, reviews the information on the mRNA information sheet, and then reach an agreement about who's going to provide the consent. Maybe it's a 12-year-old, 13, 14-year-old, and that consent is fully taken on by the parent, and that's fine. And it may be a slightly older child who then decides to make that decision. So really, it's having that conversation, and then deciding who's going to be who's going to carry the porte-parole, who's going to bring that permission to the table, and actually always at the table there's that chance to ask further questions. But definitely the parent is a very important part of this picture, but a minor who is capable of understanding and capable of expressing is able to give their own consent.
Thank you. Do you have a second question, Haley?
No follow-up. Thank you.
Thank you. I'd like to thank everyone for their time today. The next COVID update will take place on Wednesday, June 9th at 10 a.m. Please note the change in time. We will start 30 minutes earlier than usual at 10 a.m.